Do you struggle with lower back pain and you're an office worker? And by lower back pain, it can be disc complaints, it can be muscle spasm, it can be grabbing, or you may never have gone to a health professional, so it just might be in your head lower back pain. Lower back pain and sitting at a desk all day go hand in hand. The lower back pain may not bother you during the day at work. You might notice it when you exercise, you might notice it at the gym, you might notice it when you're lifting up your kids. The lower back pain that you're experiencing may not be prevalent when you're sitting at your desk. However, there's every chance that how you're sitting at the desk is the cause of it. At the ERGO Collective, we kind of believe that most people's body complaints come from their poor static postures. And where do you do most of that? At work, of course. So when you sit at your desk, it's really important to consider the postural, ergonomic, and behavioural elements of what you do over the course of a work day that may be contributing to your lower back pain. So let's have a bit more of a chat about your anatomy and how your body is designed to work, and see if we can troubleshoot why you're having that lower back pain by some of the things that you're doing at your desk. Let's talk about your lower back anatomy and how it's designed to work, and offer some suggestions as to how poor postures and behaviours can lead to chronic back complaints in terms of an office worker. What you need to understand about your lower back anatomy is that there are two things to consider. First is your core, which is something us health professionals love talking about. We would talk about the core and we blame the core for all the problems in the world. And the other thing you need to think about is your vertebra and your vertebral alignment. When we talk about your lower back and how it's designed to work, essentially your lower back is subjected to poor compressive loading. And this is the fundamental cause of most disc issues, most facet strains, and most nerve compression. It's when our body's position relative to neutral is off, and what we do is we put more strain and tension through areas that are just not designed to take that input. When you think about your lumbar spine and the lumbar discs, what should happen is they should all stack perfectly on top of each other when we sit at our desk all day. And this happens when we sit with our chest up and our ears sit over our shoulders, which sit over our hips. If I'm in this position, I'm really balanced, both left to right, and I'm really balanced both forward to back. And we think about the weight of our body relative to each of those vertebrae and against gravity. This is the best neutral, stable, efficient position that you can be in. When you run into disc issues, it's generally because we change the loading through the lumbar spine, and it puts more pressure in certain areas of the disc that is not designed to take the stress and strain. The best analogy of a disc injury is that it's like a jam sandwich. Your two vertebrae are the pieces of bread, and the jam is the disc in between. I don't know how much physics you know, but if you put very even load, compressive load through a sandwich, the jam will probably stay central in the sandwich. However, what happens is if you put a lot of pressure through the front left corner of the sandwich, the jam will spit out the back right. And this is fundamentally what a disc issue is. What it is that your body positioning is putting poor compressive loading through a specific point in that disc, which with time creates a vulnerability which will eventually end up in a disc bulge. And this is why posture, whilst you're sitting at your desk, is vitally important to maintaining ongoing lower back health. The other thing you need to think about is your core. We health professionals love to blame the core for everything, and it's actually not that complicated. What you have to understand is that your core is an endurance muscle. Your core basically connects your pelvis to your rib cage, and it is like a girdle. It goes all the way around and through to our spine at the back, so it acts like a supporting structure to improve some stability between your pelvis and your rib cage all the way around. The thing with your core is because it's an endurance muscle, it's extremely energy efficient. It has the capacity to work all day without any problems at all. But if you look at the muscle fibers within the core, it's actually quite a fine muscle. It's not big and bulky like your bicep. It's actually quite fine and flat. And as a result, it's not super powerful. This is really important when we think about posture, because when we sit with our ears, shoulders, and hips all in good alignment and we sit with our chest up, what will happen is your core will engage. It is as simple as that. If you put your spine in the neutral position, your core will engage. And that's amazing because you don't have to activate your TAs, you don't have to do pelvic floor exercises, you don't need to do planks or side bridges. Your body is really smart, and if you put your body in the right position, the core will engage. And this is a terrific stable position for the lower back to be in. However, once you slouch, once you cross your legs, once you side shift, all of a sudden you change your body position relative to gravity. The further you go away from central, the heavier your body becomes. And why this is a problem for a lot of lower back complaints is because unfortunately the core is not strong enough to balance your body weight relative to gravity. And so what happens is when we sit like this, all of a sudden your core recognizes that there's a vulnerability through that lower back and an instability, and it basically taps out and says to your body, I'm not strong enough to balance this position relative to gravity. I need some help. And so what happens is that your core switches off and your hip flexors then switch on, your gluteal muscles switch on, your lower back muscles will all switch on. And this is awesome because these muscles are strong and they're powerful and they're able to balance your body weight relative to gravity. However, they're sprinters. They fatigue really quickly and they're not designed to be used for excessive periods of time. If you do struggle with lower back complaints, having a look at where your body is positioned is really important, because what you end up doing with poor postures and poor behaviors is you end up over recruiting your sprint muscles through this lower segment of your body to basically do an ultra marathon. If you do struggle with lower back complaints, I would implore you to think about where your body is positioned over the course of the day. Think about if you keep your chest up and you're balanced left to right and front to back, your body is in the most stable position. Your core will engage to provide further support to this position, and a lot of lower back complaints will settle down. Let's have a chat about some ergonomic, some postural, and some behavioural considerations in terms of specific things office workers do to create this vulnerability through their lower back. Having a backrest in an unlocked position so that it gives every time you lean on it is a really big ergonomic problem in terms of lower back complaints. Sitting at your desk is really difficult to do all day, and it's really hard to do it if you don't have any support for your back. Backrests need to be locked at about 91 degrees, and in this position, if you rest comfortably back on the backrest, your spinal alignment is maintained in a really good position. If your backrest is unlocked, in that when you lean on the backrest, it gives under your weight, this is a really big problem because you can't rely on the stability of the chair to give you support over the course of the day. As a result, what you tend to do is you tend to slouch or you tend to perch on the office chair because you have to adopt these poor postures to accommodate the fact that the chair isn't giving you the support that you need. Sitting in an office chair all day, day in, day out, is a really fatiguing position to be in. So you need the support of a backrest, and you need to be able to rest and lean on a backrest to maintain this throughout the day. Another ergonomic consideration in terms of lower back complaints is having your backrest in a reclined position. I like to call this the sun lounger position. When you're in this position, it's terrible for your spinal alignment. Have a look at where my ears relative to my shoulders, relative to my hips are. It is miles off where you need to be. It's really important that when you do sit at your desk that you have your backrest at about 91 degrees. You need to maintain that straight spinal alignment to stop any lower back complaints. Any half-decent office chair these days should have some sort of lumbar support incorporated into the backrest of the chair. The lumbar support is just a slight curvature which should basically sit in where your lower back curvature is. If you've got a bit of cushion or a bit of support through this area, it makes it really difficult for you to slouch because that curvature should match with the curvature of your spine. What tends to happen is if the backrest is too low, it doesn't give you that support through that curvature. What I tend to do is I like to have the lumbar support slightly higher than my lumbar vertebra. If you're in this position, it actually works to stop you from slouching. If you do struggle with lower back problems, especially with disc complaints, it's really important that you do have that lumbar support positioned correctly. It's really important to check the chair depth if you are struggling with lower back complaints. The chair depth is really important for those that are at either end of the height spectrum. Most office chairs are designed to seat the majority. So we find that patients who are particularly short or particularly tall can end up with lower back complaints because the seat that they're sitting on is inappropriate for their build. It's really important that you're able to sit with your bum all the way back in the chair and that you have a little bit of a gap between the back of your knees and the seat. What tends to happen, especially if you're of a shorter stature, this positioning is not able to be achieved because if you sit all the way back in your chair, the seat actually puts pressure on the back of your knees, which feels really uncomfortable. What you do is you tend to adopt these perching positions to accommodate this angle. It's really important that when you do sit in your office chair, check the seat depth and make sure that you can sit comfortably all the way back because there's every chance that a perching posture can cause your lower back discomfort. We've discussed how perching posture is a problem for your lower back in terms of your office chair seat depth. And in a similar vein, armrests on the chair can lead to a very similar problem. Armrests are often really poorly designed. More often than not, they're too long and often they're not adjustable. When you sit in your office chair height is governed by your elbow clearing the height of your desk. What can sometimes happen is when you achieve this chair positioning, the armrest can then be at the height of the desk, and if you try and slide in closer to your desk, the armrests physically hit the desk. This is a massive problem because it means that we're sitting too far away from the edge of the desk to use the keyboard and mouse. And what we tend to do is we tend to adopt a perching posture to accommodate this difference. Perching puts huge amounts of pressure through your lower back, hips and gluteal muscles. Our preference with armrests is to remove them completely, and if you can't do that, then slide them out of the way so they can't be an issue. The perch posture is a really common position that causes lower back complaints. It's really important that when you sit at your desk that you use the backrest of your chair. It's really fatiguing to sit in this perch position over the course of the day. What you need to think about is when you're in this position, you're really hyperextending your lower spine. When you hyperextend your lower spine, what you do is you really will pinch your lower spinal discs. Disc problems and disc complaints are generally a result of poor compressive load. When you sit with good spinal alignment, the loading through the disc is fairly balanced and flush. But when you're in this perch posture, what you tend to do is you're essentially pinching the back of the disc, which will push the disc forward. When you do suffer from lower back complaints, it's really important that you maintain that good spinal alignment and make sure your bum is back in the chair and use the backrest. Sitting with your bum halfway down a chair like this is the second most common posture that causes lower back complaints. Conversely to perching, what you're doing is you're putting your lower spine into a really flexed position. You can see how much further back my shoulders will sit of my hips in this position. What tends to happen is all of a sudden your center of gravity has shifted. When you sit with good spinal alignment, like we've discussed, the load of your body should go flush through your pelvis. When you're in this position, your center of gravity has shifted back, and all of a sudden the weight of your torso and your upper body is punching out through your L4-5 discs. It's really important that when you sit, you maintain that nice right angle in through your hips relative to your spine. The slouch posture is a consideration in terms of lower back complaints also. It's not as extreme as perching or sitting with your bum halfway down a chair, but sitting in this position means that you've got your lower back into this flex position. We talk about disc injuries as a result of poor compressive loading. Sitting in this slouch position will create that poor compressive loading through your discs. Make sure that you sit with your chest up. Make sure you sit nice and tall and adjust the angle on your backrest so that it sits at 91 degrees. The side shift posture is also another classic position that causes lower back complaints. As we've touched on earlier, a disc complaint is a poor compressive loading injury. When your body weight shifts to a side, you can imagine your load distribution through those discs shifts again. What tends to happen is you put a huge amount of pressure through the right side of the disc, which will push the disc out toward the left. It's really important that when you do sit at your desk that you do maintain that alignment forward to back, but also left to right. Crossing your legs when you're sitting is another cause of lower back discomfort. When we sit with one leg crossed over the other, we create this torsional rotation through our pelvis, and that will continue and flow up into our lower lumbar vertebra, which can lead to lower back complaints. It's important that we do maintain that symmetry from left to right when we're sitting at our desk. Crossing your legs is a really common cause of lower back pain. Sitting on your leg is one of the worst things that you can do for your lower back. You can see as you sit on a leg, there's a real shift in your body weight position from that neutral central position. Imagine what this is doing to your discs. Imagine the poor compressive load that is now going through those discs because you are currently sitting on your leg. It's a really unstable position to be in. A behavioural consideration in terms of lower back complaints is again this perching posture. Your ergonomics might be right, the chair depth may be suitable for you, but what we can do is we can adapt this perching posture as a behavioural adaptation to the requirements of our job. For those of you who have to get up and down a lot over the course of the day, often it's in an administrative role, what tends to happen is when you return to your desk, you perch on the front edge of the chair because you're often in your own head going to only be there for a moment. Then what happens is you get distracted by an email or a project or a phone call, and then all of a sudden that moment turns into 3 hours and you're still in this perch position on the front edge of the chair. Perching is really bad for your lower back. It puts a huge amount of extension through it. If you do get up and down from your desk a lot over the course of the day, it's really important that when you do go back to your chair, set yourself well every single time because you never know what you'll get distracted with. As you can see, how you sit at your desk over the course of a work week is really important in maintaining really good musculoskeletal health. Fundamentally, in your body, every joint, ligament, muscle, tendon, bone, it's all got a really specific role, and if you use it how it's designed to be used, generally it'll look after you. What we're hoping is there was something in this video that jumped out at you, whether it was a behavioural quirk, whether it was a poor posture, whether it was an ergonomic issue. What we're hoping is one of those things jumped out at you, and if that aligns to your body complaint, there's every chance by addressing this and fixing this, your body complaint will settle down. If that wasn't the case and you're still a little bit unsure, what I would suggest is to continually just check yourself over the course of the day. What is my head doing? Where is my elbow? What are my feet doing? If you can continually check in with your body over the course of the day, you'll actually realize that you have a lot of consistency in terms of your postures and behaviors. And if you can identify those quirks and change them, generally you'll find that your body is in a much better position. If you would like a little bit of one-on-one attention, what I would suggest is book in for a clinical assessment with one of our staff. That way we can go through all fractions of your life to try and ascertain the cause of your complaint. Sometimes it's a little bit complicated and sometimes it's not easy and straightforward. And this is where a formal clinical assessment with one of our staff is probably the best idea for you. At the end of the day, how you sit at your desk affects your body both inside of the office, but actually more importantly, what it does outside of the office. At Ergo Collective, we're your partners in office health.